Support for Colorado Today comes from Safeway. Their pharmacists are here to help, offering a wide range of vaccines including flu, COVID, pneumonia, and RSV immunizations. Visit your local Safeway or schedule online at safeway.com/pharmacy.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
November's off to a wild start across the Front Range. After yesterday's summer-like highs near the 80s, clouds are rolling in and keeping most of the Front Range in the low 60s today. But don't put your shorts away, though. Temperatures are set to bounce right back up into the 70s later this week. I'm Arlo Perez Esquivel.
And I'm Bazi Kanani. Coming up, it sparked months of warnings and prompted the government shutdown. Now, the health insurance marketplace is open.
It's going to hit really hard in the rural parts of the state where our hospitals already are struggling.
Then, the Trump administration is telling Colorado to stop importing gray wolves from Canada.
Colorado had planned to bring another 10 to 15 wolves from British Columbia to the western slope.
And the ones that are already here are moving to new parts of the state.
Plus, what are laid-off federal workers doing since their jobs got cut?
I could put out 50 job applications and not hear anything, so you don't know if you're on the right track.
It's Monday, November 3rd. Here's the news in Colorado today.
You might start looking at your options for health insurance this week. It's the beginning of open enrollment, and hundreds of thousands of Coloradans have been warned to brace for sticker shock. That's because Congress has not yet renewed some tax credits for people who get individual health insurance on a state marketplace, like Connect for Health Colorado. It's the main sticking point in negotiations that's led to this long government shutdown. CPR health reporter John Daly is here again to give us the latest. John, who is most affected and how?
Well, it affects about 225,000 Coloradans. That's according to the Colorado Division of Insurance. It said last week that's how many people will see big increases in their health insurance premiums. And the average increase is a lot, more than double what they pay now.
Yikes.
Specifically, this change affects people who get enhanced federal subsidies, also called tax credits, through Connect for Health Colorado. It helps them afford to buy health coverage. These enhanced subsidies are basically extra cash for people who already qualified for Obamacare tax credits, and they also help middle-income people who previously weren't eligible for credits. Michael Conway is the state's insurance commissioner.
It's really everybody outside of the Front Range gets hit really hard with the premium increases, and the Front Range gets hit hard too, right? We're talking about an average 100% increase across the state for people that have subsidies.
And I can tell you about one patient in particular I talked with who really drives home what this means.
Please.
Okay, Chelsea Baker-Houck is self-employed. She runs a consulting business. She gets some really expensive treatments because she developed a really serious condition after she had COVID.
My immune system is attacking my organs and my heart and my nervous system. So I get this treatment and this keeps me going for another 1.5 to 2 weeks, and then symptoms come back and I have to do it all over again. You know, each treatment, each dose is about $8,000. Obviously, I could not afford that on my own.
She gets a subsidy to help pay for her insurance, and she's really stressed about the price increase.
I've already started going off some of my medications to see how I do, because I know I can't afford all of them.
Now, when I talked to her last week, she didn't know the final figure yet, but she was looking at the averages and doing the calculations.
I just want to cry, honestly, because I don't know how I can afford to do that.
You really feel for the situation she's in.
Yeah.
What about families with kids? What can they expect to pay?
Well, a family of four with an annual income of about $128,000 will no longer qualify for any financial assistance if the tax credits are not extended. For families that will still qualify, they can expect health insurance premiums to increase by about $14,000 a year for a standard plan. That's if they live in the Denver metro area. It could be much more in rural Colorado.
$14,000 or more is a lot of money for most middle-class people.
For sure.
State insurance marketplaces are the result of the Affordable Care Act, also known as Obamacare. If Congress ends the enhanced subsidies for these health insurance plans, does it effectively end Obamacare?
No, I would say it doesn't effectively end Obamacare or Colorado's marketplace, but it will mean a lot more people are uninsured. The state estimates the premium hikes will force about 75,000 Coloradans to dump their insurance altogether. Here's Colorado Insurance Commissioner Michael Conway again.
It's going to hit really hard in the rural parts of the state where our hospitals already are struggling, where our hospitals already are feeling the crunch from the Medicaid cuts that are coming and this now on top of it.
As you mentioned, Bazzi, the government is shut down because of this issue as Democrats try to pressure Republicans to extend the subsidies. We're all waiting to see if Congress can come to some agreement. But Republican House Speaker Mike Johnson said last week that he opposes the tax credits for health insurance because he said they're, quote, subsidizing bad policy. He said Republicans have a long list of ideas to handle healthcare costs, but he didn't offer any specifics. We don't know how long it would be before any of those ideas could be implemented. Some liberals would agree that the subsidies are only necessary because there's no universal insurance program to cover everyone, but that doesn't mean they agree with the Republicans on what a solution would be. Commissioner Conway keeps saying that Coloradans need to get the subsidy issue resolved right now.
It is incumbent upon Congress to act here to help Coloradans. If they don't, we're going to be in a disaster for our healthcare ecosystem.
It does make me wonder, John, what's happening with the price of health insurance for everyone, for people who don't enroll through state marketplaces? Will they also see higher prices next year?
Those prices, like for people who get their insurance through an employer, are expected to rise as well. Premiums for job-based health insurance rose 6% nationally in 2025, according to KFF. Also, the more people who are uninsured drives up health costs for everyone because uninsured Coloradans, they need health care too. They often delay care and wind up getting cared for in hospitals and emergency departments, which is much more expensive.
John Daly, thanks for your reporting.
You bet.
Colorado has been planning to bring more wolves into the state this winter, but now the Trump administration is intervening. It says Canadian wolves are not allowed. CPR's Dan Boyce is reporting on this and other new developments in Colorado's wolf reintroduction efforts. Dan, how is the Trump administration involved in this now?
This order, it came down from the U.S. Fish and Wildlife Service, and the agency said to Colorado Parks and Wildlife, hey, your wolves need to come from northern Rocky Mountain states only. All other relocation efforts you have for wolves have to immediately stop. And that's important because Colorado had planned to bring another 10 to 15 wolves from British Columbia to the western slope this winter, and now that appears unlikely to happen.
And why is that? Is there a problem with Canadian wolves specifically?
Well, the Trump administration says that this is about following rules. So Fish and Wildlife is interpreting an initial rule from the federal government in 2023 about where Colorado's wolves had to come from. And they say it requires that these wolves come from the Northern Rockies, whereas environmentalists, advocates say that was just a preference in that rule, not a hard and fast requirement. And so why would the Trump administration be trying to make it harder for Colorado to bring in wolves? So it didn't cite this in this letter, but we know there has been vocal opposition ever since the wolf reintroduction effort narrowly passed in 2020, especially in rural and traditionally conservative areas. So there are about, say, 30 wolves in the state right now, and there's this ongoing tension between wolf advocates and ranchers on the western slope because livestock sometimes do get attacked by wolves.
If Colorado can no longer get wolves from Canada, can we just turn to other Rocky Mountain states and get wolves from them?
It's unclear, but it's harder. So earlier this year, 15 wolves were brought in from British Columbia, but the first 10 wolves that Colorado got in 2023 were from Oregon. So maybe Oregon? I don't know. Colorado hasn't said whether Oregon could be an option again. However, other states where there are wolves, like Idaho, Montana, and Wyoming, have said that they do not want to work with Colorado in bringing in more wolves, even though they themselves brought wolves in from Canada for their reintroduction efforts in Yellowstone in the 1990s. So anyway, big picture so far, Colorado has not really shown that it can have a sustaining wolf population on its own yet. Wildlife managers had been planning to keep reintroducing them in batches like this, with the idea that long-term, between those reintroductions and with natural reproduction, that the state would have a total population of about 200 wolves. So Colorado Parks and Wildlife says they are in contact with the Department of the Interior and are exploring their options for other wolf releases.
Dan, you've also been reporting on what's happening with the wolves that are already here. Again, there's now about 30 of them at this point. How are they doing?
Since those initial groups were reintroduced, Colorado Parks and Wildlife has been tracking the movement of those wolves. All of those wolves were fitted with GPS collars, and the state releases a map monthly. And October's map shows wolf activity reaching further into the wide open and vast San Luis Valley than they have ever gone since being reintroduced. And I'll note, when we talk about this kind of vast wolf movement, we're not talking about wolf packs. What we're talking about here are lone individual wolves. And this is according to Parks and Wildlife Wolf Data Monitor Brenna Cassidy.
Their goals are to explore, to find a mate, to find a territory. Like, that's not something that's going to go away, because that is part of wolf biology, is for them to, grow up in a pack, become an adult, and leave their pack to go try and find a new area.
And Cassidy says these lone wolves, they can travel 100 to 200 miles a week. And we know that they've been close to the borders with New Mexico and Utah. We don't know for sure if they've crossed over into those states, but Cassidy says that those bordering states are supposed to capture and return those wolves to Colorado if that happens and if they're found.
CPR's Dan Boyce. Thanks, Dan.
You're welcome, Bossy.
Katie West is one of thousands of employees who worked in international aid who got laid off by the Trump administration. She lives in Boulder, and when she lost her job in July, she went into a bit of a crisis of confidence. After all, she worked at USAID for a decade. In what may sound like a very Colorado decision, she chose hiking.
I wanted to accomplish something that I could point to as an accomplishment and see like a tangible result.
CPR reporter Molly Cruz met West, along with several other former federal workers, who are finding a path forward now. Molly, give me an idea of the distance of this hike here. What did West set off to do?
Yeah, so she decided to hike the Colorado Trail, which runs from Denver to Durango.
Yeah, it was to prove to myself that I could get through a hard thing, that I could believe in myself to do something hard.
It took her 39 days, and she did it.
39 days? What else motivated her?
Well, it really affected her to see USAID's work dismantled and wiped offline. It was a decade's worth of her work.
It really felt like everything, so much of it was erased.
She worked for the USAID's food security program overseas.
I think a lot of us have felt that pull to just leave everything behind, especially after something like that. But it sounds like for her, even when she was out there, she couldn't really leave her work behind.
Right. She made it part of her journey to educate people about what USAID had been doing. So every time she got to a reef supply town along the trail, she posted a photo of herself to Instagram with a caption about USAID's work. She also recruited a few of her former colleagues to write about their work. She really described this to me as a grieving process. She had to grieve the loss of her job and also what she described as her life's purpose.
And now she's back. What is she doing now?
Well, that's the hard part, right? Ending a big journey like that and figuring out what happens next. So this is what she told me.
My challenge now is how do I translate that to real life where it's much messier, it's not clear, it's not tangible, especially when you're in a low feedback environment, right? Like I could put out 50 job applications and not hear anything, so you don't know if you're on the right track. And so whereas the trail is so clear, you know whether you're on the trail or not. You know whether you got to your campsite or not.
So in terms of some more tangible things in order to get by, she told me she's doing odd jobs like walking her neighbor's dog, doing some yard work, or working at a stall at the local farmers market in Boulder. She's also volunteering. I actually met her at an event in Lafayette with other laid-off federal workers. They were at a community garden and a food bank there.
We're just staining this fence that she wanted to have stained. They've done part of it.
This is Jan Cartwright.
It's hard when you're unemployed, to feel like your work is still valued. So volunteering can do that in the short term.
Katie West was organizing compost piles as she talked to me about how the layoffs have affected her livelihood.
So it feels like really ironic to be on the other side of the equation where I spent my whole life trying to contribute to the things that helped other people at the edges of economic viability, and now I'm in that spot. And yeah, it can be kind of embarrassing or hard to ask for help when that's not something you've had to do before in your life.
That definitely sounds like a difficult position. Did you hear them talk about any other steps that they're taking since the federal employment ended?
Yeah, another federal worker named Karen Fowle, who lives in Boulder, told me she and some other former colleagues have started their own firm.
Most of us did not expect to be entrepreneurs or founders of a company, but we felt like around the world there was still a lot of need and demand for the type of services that we had been providing when we were part of USAID. And
so they help connect communities to the internet, access government services online, and they're promoting the use of ethical AI.
So it has been slow, right? There hasn't been a ton of business, but it's nice at least to be continuing the work we were doing, starting something new, feeling like we're building something.
And they all talked about how groups of fired federal workers have gotten together to help each other fill out unemployment benefit applications or do resume reviews. They've at least found a community with so many people laid off at the same time.
CPR reporter Molly Cruz, thank you.
Thanks, Arlo.
Thank you for listening to our show. I hope you got to enjoy the extra hour of sleep this weekend, or if you're out enjoying Halloween, some extra time before last call. I'm Arlo Perez Esquivel.
And I'm Bazi Kanani. This is CPR News.
Support for Colorado Today comes from Safeway, where you can shop online and get easy delivery or free pickup. Get the same prices, deals, and rewards as in-store. Shop the weekly ad, clip deals, and earn points at Safeway.com or in the Safeway app.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.